Hello, I'm Pam Whelan, Director of Group Sales for Dimplan.
I'm joined today by Richard Alexander, who along with his wife Ailey Craig took over Greenlaw Dental Care.Practice 12 years ago when Ailey's father, the previous principal, retired. Greenlaw Dental Care has been a family NHS practice in Paisley, established for over 60 years. I was delighted that in October 2020, we had the privilege of welcoming Richard and Ailey, along with their 3 associates and practice team, into the Dimplan family. Richard has kindly agreed to chat with me today to share his experience of joining Dimplan and, importantly, the motivation behind introducing private care into their practice. Richard, you've previously described the motivating factor to convert as taking back control. Can you explain the catalyst or your experience that was behind this change of tack?
First off, obviously, thanks for having me. From my point of view, the transition has been as straightforward as we could expect it to be, and the catalyst for us was obviously the pandemic was the main change to the working environment, and for us it boiled down to the fundamental part that patient care wasn't being accessed, wasn't being provided at the level that we were happy with after the initial changes to the dental setup in Scotland from the NHS restrictions. And for us, we had to be able to give our patients a better option, a better choice about how they wanted to look after their own mouths.
Great, thank you. And you've been well published recently, following your experience through the pandemic and coming out of the pandemic. And one of the quotes that you mentioned in a recent article was that it's been an easy change, and you've subsequently questioned yourself why you hadn't done it earlier. Can I ask why you hadn't?
It's an interesting one. I think we hadn't because one advantage to having a practice that has been so stable and in a community for so long is that you don't want to make huge changes that seem like you're maybe going to alienate the patient base that you already have, that had been there for so long. You know, we've had patients that have 3rd generation families that we still see all the family members, and you know, the practice had gone through a lot of changes in the last 10 years from Ailey's dad retiring and the other partner, Mr. Drummond, retiring as well, to us coming in and modernising the practice and expanding the practice. So for us, it was something that was always about what time would we do that, when would we do it? It was just always, when do you implement that change? And for us, I think there was always a maybe fear is a bit strong, but an apprehension about how would it be accepted by patients as well. And I think the thing is, what we've probably learned from this process is that you probably overthink these things based on a business owner and as a clinician about what will patients, how will they react, what will they say. And you realise that, unfortunately, actually, just because you see a possible roadblock or a possible barrier doesn't mean that the patients actually will as well. A lot of the time, they actually see things from a completely different way that you do, and that has to be remembered, because for us, it was about, let's keep things stable. And you realise actually in making this huge change, it's been one of the best things that practice has done in the last 5-10 years.
So one of the main concerns or barriers that you felt was around how the patients would accept this change, and that is something that didn't translate into reality.
Absolutely.
Yeah.
I think you know, Scottish dentistry, you know, the NHS is a different system up north, and there's very few fully private practices in Scotland. I think there's something of about 8 practices in Scotland that are fully private. So mixed dentistry up north is far more the business model that everyone goes for, and that can be from being 90% private but still having an NHS cohort of patients. And so I think there was always that element of you don't want to push away the base of patients that have always been a staunch NHS or what have you as well. But for us, I think the thing was that you realise that with the change in the setup and the change in the pandemic and the inability for patients to access the care that they would normally be so easily and so readily available, then actually it was something that this gave us that option for patients. And you realise giving patients that choice is the best thing you can do, because they make it on their own without you having to overthink, oh, will they, won't they, or is it going to suit them? So I think there's probably just an element of apprehension from previous, having had little experience of dental plans, other than it's something you feel you should have as you move forward. And that was obviously probably just something that's been completely turned on its head, and it's something which for us now the plan is part of the practice that will be here to stay for as long as we're there.
It's an interesting point you make about patient choice and your perception of how the patients may react in introducing this a private plan into the practice. Do you get a sense that patients are perhaps more aware, more sort of cognizant of their own responsibility to look after their own health and well-being, and that the opportunity of joining a plan and securing that increased time from you as a clinician to discuss preventative care in more detail? Do you get a sense that there's been a shift in patients' willingness to embrace that?
Absolutely. For us, one thing that you noticed is that before, it sounds daft, but before you probably had the driving force of your 6-month checkup routine was the practice. Having that routine, having that, make your 6 months at desk, you get your text reminder, encouraging patients to be in that routine, because you knew that that's the best way to do preventative dentistry, to encourage that, booking in with a hygienist. And what became apparent after the pandemic was just the sheer volume of patients who wanted to be in that routine. It's so common to hear people say now about, but I want my 6-month checkup, I want to see the hygienist. That before you felt was probably you're trying to encourage them, you're trying to highlight the benefits of why they should be looking after their mouths and preventative care. And when that was turned off and all you had was reactionary and emergency care, that I think has then had long enough now that patients have realised, crikey, it's not just 6 months, it's 12 or 18 months since the last time I saw the dentist. I need to be in. And for us, without Denplan, patients wouldn't be able to be accessing even routine examinations in the practice. So at least from that side of things, it gives the patients who are most willing, and also and the patients who are already wanting to look after their mouths more, it gives them that ability to do so. And so we've noticed not only the longer appointments obviously being beneficial for the clinicians and also for the patients, but just the hygienist has never been busier as well, because then they're saying, well, that's part of that they're in for. I have a waiting list of patients that I've never had before. We never had a waiting list before. Now you have to have one. It's given us the ability to restructure our appointment diary, to have preferential appointment slots that we always talked about before as being, that'd be good to have that on a late night or early morning, and it always kind of got away from the practice because we were too busy. So actually having that ability to restructure it has meant that some of those changes that we wanted to introduce but never quite felt the right time have then all come into place at the same hand. So for us, we feel it's not just the Denplan benefits themselves, but the overall running of the practice has then benefited from it too.
It is absolutely fascinating, the change in patient behaviour, but also the probably peripheral added value benefits that you're experiencing within the practice, which brings me on to your team. And we all know that when you implement change, getting the team fully on board and engaged is vitally important in driving the success. So how did you and Ailey approach this with your associates and the wider team? And how did they react and adapt as a team to this sort of new working approach?
To be honest, it was all about, from our point of view, all about communication. We were very open and honest with the associates about what our plans were and how we were moving forward. Through the pandemic, we'd had monthly meetings with the staff still on Zoom, because you couldn't have staff meetings in the practice, and we'd had all the changes in regulation, the group chats and all the different things, for the ability for everyone to still be aware of how the practice was changing, how things were moving forward. So the communication and having those chats about the open and honest transparency with the staff, so they knew that you were introducing these things as a positive, as a how do we look after our own practice, how do you look after their jobs, their enjoyment of their jobs as well, about what would you rather be doing with the profession. And obviously then with the staff, it actually was a far easier transition for them as well, because they were all on board before we had the paperwork and the training and everything, for the fact that they knew that this was where the practice wanted and needed to go. And the staff have been superb with it. The extra training is obviously has helped to give them, the knowledge and the understanding and the ability to talk to patients about the benefits, but also just to have the fact that the whole team were on board. We had surprisingly very few negative comments about moving forward in that way. And again, I think it probably falls into the same bracket of when you're talking about patients and their perceived apprehension. You realise so many of these things are based on what your own concerns would be, not actually what everyone else is going to actually experience. And I think that ties in with so much dentistry that, it sounds, again, cheesy, but treat people as you expect to be treated. Your granny tells you manners cost nothing. All these things translate so well to how you treat patients, how you treat your staff, and I think that's the thing, is that having that open and honest discussion why you're doing it, so they don't think it's just you're moving towards private for purely a financial reason. It's them understanding that there's the core ethos has to be about patient care, and how that's going to benefit the patients, and how they will then enjoy their job working with those patients and being able to do different treatments. It has to all go hand in hand, instead of just thinking, oh great, there's someone doing more private dentistry, what's benefit do I get as a staff member, if that makes sense.
Yeah, no, it absolutely does. And as a clinician yourself, what has that meant for you from a professional perspective, being able to dedicate that time to your patients and their care?
It's been a huge change. It's I think the thing at the moment is it's fallen in so perfectly in terms of timing that patients need more of our time now, because of the fact that it has been such a difficult year, dentally, never mind, personally, professionally, for everybody. So the normal situation of then saying, great, there's your normal appointment slot, having the ability to double and treble that as a genuine point of how long you're booking off those appointments. Patients benefit from that because of that side of things. But as a clinician, then you have the ability to do whichever treatment they require, and giving them those different options. And actually, it's meant a lot of the clinical decisions are much easier, because you still have to have your consent and your discussions about what's the right treatment option for a patient. But the decision is easier for the patient, because they're not having to worry about what's this regulation and what's that change. And that was so evident through what would have been probably July to October last year, where trying to explain to a patient why they can only have a tooth out instead of me using a drill as a dentist is like a fireman saying he can't use his hose. Like it's just, it never made sense as a patient coming in and needing something done. And so for us, being able to take that off meant that then you could have the treatment that was right for the patient. And as you probably noticed, I like to chat, so having long with the patients is also beneficial. But patients seem to be responding to it. They enjoy the fact that they do have the preferential slots, and other things that go with that is that then they just know that they're not going to be affected by the change in regulations that go forward, because the uncertainty moving forward is such a huge thing for patients just now. They not knowing whether they can access care or what care they can access, knowing that there's that stability, I think is one of the biggest things that they're responding so positively to.
Fantastic, thank you. Now, choice was something you talked about there, patient choice for you as a clinician as to how to treat your patients. So when we're talking about choice, you also had a choice with regards to which provider you went with in order to introduce private plans into your practice. You chose Dimplan. Can you just explain a bit around why Dimplan was the choice for you for your practice?
Well, I mean, I think it touches again on the why had we never implemented things before. We'd had other providers out to talk to a few years ago, and just maybe never got the same level of service or commitment from an early stage. And then for us, when we'd had the first discussions with Heather, it just fell into place. It was just a very straightforward connection. But when you actually, had all information provided and you could make those decisions based on what extra you guys can provide, that was something for us that was so important. But when you say choice, unfortunately, so many people make choices based purely on a financial aspect and not on a greater service provision, and I guess that falls into the exact same philosophy that you then have to move forward with, which is you don't want to go for something just because it's cheaper, because of how the world is. You want to go for what the service you're going to get, and you get what you pay for. And from our point of view, it has been as straightforward a transition. Every member of staff that we've dealt with at Dimplan has been superb. Honestly, it's from the initial meetings and the training sessions as well. It's something, I know I said this already, something we should have done before, but a huge change to a practice that has had no changes in that way for 60 years to then have something that we've had a seismic change, and it feels like it's just a natural change, has been very straightforward. So it's making my life easier, which through the pandemic is only appreciated, to be honest.
Excellent. And as I always say to my partner, buy cheap, buy twice.
Absolutely.
Now, you mentioned Heather. Heather is your business development consultant and has been with you throughout the journey from inception and is continuing to support you. When we go back to the challenges and the beliefs that you had, how did you feel that Heather supported you or challenged your beliefs throughout the journey?
It's funny you say challenged, because she was very, very tactful and subtle in pointing out that you needed to change your mindset in some ways. But no, she was great, honestly, very quick to respond to any query, no matter how small. I had random ones, even after we'd signed up. It was someone's asked this and I hadn't thought of it. And, she was away finding the answer and phoning you back. So when you're saying buy cheap, buy twice, for me, it's the same as even when we're using, which implants we're using in the practice or what we're providing in terms of for our composites and the bonding and things. You need to be comfortable with the level that you're getting from that that you're buying effectively, and from the Dimplan side of things, it's that customer service is what you're needing, what you're wanting as a practice for the whole team to have. And that's been something that's just so easy to access and never had any issues with. And to me, that's that fundamental part that's so important, is it's that support that you get. Fab.
And you've also taken advantage of our market leading training team, the Dimplan Academy. What is that? What benefit has that brought to the team, and instilling that confidence in the changing conversations that they need to have with patients?
It's been great, because actually, with the pandemic as it is, and obviously having to do things far more virtually, it actually made it easier for us to organise the training, and the staff could all then log on from home when they were working part-time and things. So that was beneficial. But it just meant that then the timing that we managed to introduce, from introducing the Dimplan to the practice, but also providing the training, meant there was no delay to that. So it was a straightforward and structured approach to it, instead of, we've brought this in and then there's no training for 3 or 4 weeks afterwards and everything else that goes with that. I think the advantage in the training obviously has been that the staff then find themselves comfortable to talk to patients. They find themselves able to know what the products are, or know what the differences in the products are, because it has to go from the front of house. It sounds cheesy, but you go to a nice hotel, the experience starts when you pull up outside. It doesn't have to, you might be staying in the nicest room, but if the service all the way through doesn't match, then people aren't going to understand what you're trying to provide. And so for us, it's why every member of staff needed to understand and believe in the change for the practice, to have that training, have that ability to discuss with patients. Because from that first port of call, just even an inquiry on the phone, yes, patients love to have the chat with the dentist, amazing what they'll say on the phone and then what they'll say to the clinician. But it's why the whole team have to be involved. Otherwise, you're just not going to get that transition, because patients aren't going to then be led down the right discussions in terms of what they want to know about. Because if your staff aren't wanting to or aren't able to discuss it, then the patient's going to miss out on what's actually the best option for them. The training, honestly, it was all very straightforward, with the online webinars to give you that pre-training, and then and everything done on the Microsoft Teams was straightforward and easy set up, and we've got other ones organised. And for us, it also gives certain staff members, we've now got two staff members who've signed up to the Dimplan Champions programme as well. So it gives them an extra feather in their hat, as such, an extra responsibility that they can focus on, and it gives that structure to the team as well. So it's been beneficial.
Fantastic. And we know that having a happy practice team is vitally important to the success of a practice. And it was one of the three key pillars that came out of our research with our members. We identified three key areas of importance for dentists. The first, having returning orally healthy patients. The second was fear of non-compliance. And the third, as we've just talked about, was having a happy practice team. As part of your Dimplan membership, you signed up to our newly launched Dimplan Plus proposition, which absolutely aims to address these three key areas. What has been most beneficial for you and your team from having access the wider range of benefits that Dimplan Plus offers?
Well, for us, I think it was the extra training, the extra availability of that is so important, because instead of it just being, we've introduced a product and then there's nothing else behind it, nothing else backing it, and that's that support. For us as well, I think, with the Plus and the growth program, for us, in terms of patients, particularly the lack of joining fee is a huge thing, and from a business point of view, that makes perfect sense. We're committed to this for long term. A partnership effectively is a good way of thinking of it. So the benefits for both, but that's definitely helped us drive more patients a kind of understanding of what they're actually benefiting from, and not having that sign up is a great ability to have that carrot on a stick, for want of a better phrase. It's just the whole involvement of all the team. One thing that we're very proud of is that we the staff do have to rotate, particularly through how the new pandemic has been. We had mainly full-time staff that then had to move towards clinical bubbles and everything else. So it was so important that all the staff were involved, because you knew that it was a changing team every day based on which clinician was in. And I've had no issues with whichever clinician and whichever staff members on reception or in surgery has just shown that it was the right decision for the practice, because everybody's on board, and that support. Thankfully, we've not had any staff have to utilise the employee assistance programme, but things like that again are great to be able to offer to your staff, that there's extra benefits for them individually, not just as a practice, but for them personally as well. But hopefully no one has to use it, but it's a great thing having as a possibility.
Great. It's having that holistic support, isn't it? As you say, the comfort, the confidence of knowing it is there in the event that you would need it. You and Ailey, you've got two young children, clearly busy principals. Work-life balance must be a challenge for you both. And I appreciate that you're still in the early days of your journey, your partnership with Dimplan and Greenlaw Dental Care. Do you envisage in the future that, having introduced Dimplan, that the work-life balance will improve for you, for both you, work and the family?
I think it already has, to be perfectly honest. I think from us, it's one of those things which, again, it goes back to the same wanting to change things, but not wanting to upset the apple cart too much. The changes that we've made have meant that like today being a Friday, that I would never have normally had a Friday off, whereas moving forward, the ability to have that change in the working hours and the balance is definitely what we need from having young kids and wanting to enjoy the time with them, wanting to enjoy family life. What it's also let us do is have the ability to not feel like as guilty about stepping away from that in a way, because running a dental practice is all consuming. As a dentist, you qualify and you before you know it, you've done your extra training in hospitals and things like that, and then before you're an associate and buying a practice, and that whirlwind doesn't really ever stop. And then you realise actually what's happened is you're too busy, there's too much going on, and you need to be able to take that step back. And if something like Dimplan that lets the practice not have to be 100 miles an hour all the time, because you can actually reflect that a little bit more, it's hugely beneficial to the stress levels as well.
Brilliant. Richard, finally, if I could just ask for your insight. Every new member who I speak to has the same advice to give those who are considering introducing Dimplan or converting. The typical advice that I hear is take the leap of faith, don't let fear get in your way, trust the advice your Dimplan consultant gives you, don't wait for change, make the change happen. Similar to the conversation that we have just had. But what words of wisdom would you, Richard Alexander, share to give that confidence and to help quantify this advice to others who are in that stage of considering, but still got that sense of reluctance for the challenges that may be ahead?
I think it has to be that go for it. You regret the things in life you don't do more than the things you do. And I know that sounds daft, but you have to be proactive. You have to push forward, and every practice will have its own belief and ethos as to how they want to move forward. But if you're stopping and wondering, hold on a minute, is this really how I want to be doing my working day? Is this the most enjoyment? Is this really the stress and the busyness that I want it to be? And you're not enjoying it, then you need to change things. And for us, that was part of the pandemic. For us was I'm very fortunate. I've got a wonderful wife and kids and a great practice, and I genuinely enjoy doing dentistry. And the pandemic really shook that, particularly for my wife. And you realise that actually the hardships of trying to run a practice through the pandemic was the most stressful time in our life. There's no doubt about it, and that involves, when we were buying a practice and having 2 kids and adding 2 extra surgeries onto the practice, it seems like a walk in the park now compared to the last year. So the advice has to be in control of your own choices, be in control of your own destiny, for want of a better word, because if you don't, then you're just getting carried along with the changes that are happening in front of you, and you'll regret the fact that you didn't. It's definitely something about being proactive, and I think the new normal has definitely proven that with so many industries. The ones that are reluctant to change are the ones that seem to be struggling the most. So it's definitely a better to be positive and make those changes than it is to not.
Be in control. Richard, thank you for joining me. Thank you for sharing your insight, your experience, your journey with us. And I wish you and Ailey all the continued success. And I genuinely look forward to a long and productive partnership with you at Greenlaw Dental Care. Thank you.
Thank you very much.